गुड मॉर्निंग, नमस्कार। मैं डॉक्टर सुनील मिश्रा, इंडोक्रिनोलॉजिस्ट, मेदांता हॉस्पिटल से अगेन बैक टू यू। सो आज हम वर्ल्ड थायराइड डे के बारे में जो एक सेकेंड हमारा टॉपिक है उसको डिस्कस करने जा रहे हैं। और वर्ल्ड थायराइड डे सेलिब्रेट करने का मतलब है कि हम थायराइड ग्लैंड से और उससे होने वाली प्रॉब्लम के बारे में लोगों को और कॉमन लोगों को अवेयरनेस दें। सो यूजुअली हम ये प्रोग्राम इवनिंग में करते हैं, बट बिकॉज ऑफ द जैम पैक प्रोग्राम ऑफ आवर एक्सपर्ट्स we are doing in the morning and most of the people might be in the office at present. So thank you viewer for joining with us. So आज हमने जो टॉपिक रखा हुआ है, कल हमने थायराइड नोड्यूल और थायराइड कैंसर के बारे में डिस्कस किया था और आज हमने एक स्पेशल टॉपिक रखा है थायराइड डिसफंक्शन इन वीमेन। मेरे साथ दो बहुत ही एमिनेंट एक्सपर्ट्स हैं इसके बारे में। एंडोक्रिनोलॉजी से डॉक्टर हरमनदीप कौर गिल, शी इज सीनियर एंडोक्रिनोलॉजिस्ट in the division of endocrinology and diabetes Medanta. So उनका more than 15 year of the experience है endocrinology के field में, and she is renowned for her work in thyroid, adrenal gland and other hormone dysfunction. Welcome, Dr. Harman. And my other expert is Dr. Preeti Rastogi. Dr. Preeti Rastogi is director and head obstetric and gynecology. I'm also very experienced gynecologist and obstetrician, more than 25 years of the experience. So as soon as she is able to join, I will welcome her and will take question from both my experts and will also take question from the viewers. So मैं इस तरह से हमने प्रोग्राम को रखा है। पहले हम थोड़ा सा अपने एक्सपर्ट से सवाल पूछेंगे ताकि आप लोग कॉमन चीजों के बारे में जानें, और उसके बाद वो चीज आपको थोड़ा सेंसिटाइज करेगी सवाल पूछने के लिए, और आप अपने सवाल क्वेश्चन बॉक्स में डालते रहिए और हम कोशिश करेंगे कि अधिकतम सवालों को हम आंसर कर सकें। सो सबसे पहले मैं डॉक्टर हरमन आपसे पूछना चाहूंगा कि ये थायराइड ग्रंथि क्या होती है, थायराइड ग्लैंड है, इसकी इंपॉर्टेंस क्या है, एंड स्पेशली आज हम केवल वुमेन के बारे में बात कर रहे हैं, इट्स इंपॉर्टेंस इन द वुमेन। डॉक्टर हरमन।
सो थायराइड इन जनरल अगर हम बात करते हैं, थायराइड ग्लैंड वी ऑल नो, बच्चों को आजकल स्कूल में भी पढ़ते हैं कि छोटा सा एक बटरफ्लाई शेप का ग्लैंड है हमारी नेक में, जस्ट अबव द कॉलर बोन, एंड दिस इज जस्ट यू कैन से बिलो द स्किन। इट इज अ वेरी स्मॉल ग्लैंड बट इट इज वेरी इंपॉर्टेंट ग्लैंड. So as we all know, being endocrinologist, that in endocrinology most of the diseases related to hormones. So number one, if we talk about the incidence, prevalence of the hormonal diseases, thyroid is the number one after diabetes. So diabetes is pretty common, but thyroid disease is the next one. So अगर हम फीमेल्स की बात करते हैं तो फीमेल्स में जनरली देखा जाता है कि अगर 10 फीमेल्स को आप खड़े करो तो एक में थायराइड डिसऑर्डर निकलता ही है. It is so common. So thyroid gland as such, it is very important for our body. Thyroid gland के जो hormones हैं, they affect almost each and every part of your system. So right from your skin, from your hair, from your like external things to internal, your brain, your heart, your bones, your muscles, your GI tract. So everything is affected by thyroid hormones. और थायराइड डिसफंक्शन एज यू नो, जो भी ग्लैंड होता है क्या हो सकता है उसमें, या तो उसका इट इज नॉट वर्किंग टू सफिशिएंट लेवल, तो हाइपोथायराइडिज्म हो गया कि हार्मोन्स कम हो रहे हैं. अगर ज्यादा काम कर रहा है तो हाइपरथायराइडिज्म हो गया कि ज्यादा हार्मोन प्रोड्यूस हो रहा है. दैट इज ऑल्सो नॉट गुड फॉर योर बॉडी. सो बेसिकली थायराइड हार्मोन आपके पूरे मेटाबॉलिक एक्टिविटी को कंट्रोल कर रहा है. डायरेक्टली इट मे नॉट बी डूइंग मच, बट each and every एक्शन इन योर बॉडी. सो चाहे वो हार्ट रेट है, चाहे ब्रेन का थिंकिंग पावर है, चाहे मेटाबॉलिक जितने भी हमारे प्रोसेसेस चल रहे हैं बॉडी में, उनका काइंड ऑफ स्पीड जो रेगुलेशन है वो थायराइड करता है. अगर थायराइड हार्मोन कम है बॉडी बिकम्स स्लो, एंड अगर थायराइड हार्मोन ज्यादा है बॉडी बिकम्स हाइपर एक्टिव. Generally, in general terms, that is what we say. So it is actually affecting each and every part of your body. Or females may, you know, there is a very delicate balance, right? From puberty, like menstrual cycle regulation, कितना ज़्यादा एक delicate process है. थोड़ा बहुत उसमें imbalance हो गया तो there can be menstrual irregularities. Then egg development, then your, you can say conception, right? Then comes the menopausal hormonal imbalance. So everything in female, I think it is more important because all that balance is very delicate. और अगर उसकी processing में, उसकी metabolism में थोड़ा बहुत कुछ change आता है, तो that is like everything gets disturbed. So for females particularly, it is very common. I mean, it is very important, I would say.
थैंक यू। तो आपने बहुत अच्छे ढंग से इसको समझाया कि ये थायराइड हार्मोन की जरूरत क्या कैसे है ओवरऑल ह्यूमन बीइंग में एंड स्पेशली पर्टेनिंग टू लेडीज वीमेन में इसका इंपॉर्टेंस क्या है। वी वेलकम डॉक्टर प्रीति रस्तोगी। मैम इज नाउ प्रेजेंट अगेन। मैम इज सीनियर डायरेक्टर एंड हेड ऑब्स्टेट्रिक एंड गायनेकोलॉजी एंड more than 25-30 year experience of working in obstetric and gynecology, and she's wide spectrum of the patient of obs and gynae. So ma'am, वेलकम। एंड मैं आपसे पहला सवाल पूछूंगा कि थायराइड डिसऑर्डर अफेक्ट वुमेन बॉडी, क्या साइन एंड सिम्टम्स होते हैं आपके पास में पेशेंट आते हैं, आप कॉमनली डायग्नोज करते हैं क्योंकि पेशेंट तो पहले आपके पास में आते हैं तब आप हमारे पास में रेफर करते हैं, तो यू सी वाइड वैरायटी ऑफ द पेशेंट।
जैसे कि डॉक्टर हरमन ने बताया कि थायराइड जो है वो वुमेन को अफेक्ट कर सकता है किसी भी एज पे, और रफली 1 in 10 women in their entire life can get affected by the thyroid dysfunction. So हमारे पास जो पेशेंट आते हैं, so we deal from puberty till menopause. The different age groups can present with different symptoms. यंग गर्ल्स में यूजुअली आजकल ये देखा गया कि थायराइड डिसऑर्डर जो है वो पीरियड इरेगुलरिटी करता है। तो या तो किसी में जल्दी पीरियड शुरू हो जाते हैं या किसी को हैवी पीरियड्स आते हैं जब शुरू होते हैं एट द टाइम ऑफ मेनार्की, और अगर ये लो मतलब कम काम कर रहा है तो प्यूबर्टी डिले भी हो जाती है। अगर हम रिप्रोडक्टिव एज ग्रुप की बात करते हैं तो रिप्रोडक्टिव एज ग्रुप में ये मेंस्ट्रुअल डिसऑर्डर जो है उसके लिए मोस्ट कॉमन रीजन है थायराइड डिसफंक्शन। मेंस्ट्रुअल डिसऑर्डर का मतलब है कि पीरियड जल्दी जल्दी आना, या पीरियड में ब्लीडिंग ज्यादा होना, या फिर किसी के पीरियड लेट होना, डिले हो जाना, और women also present with weight gain. Common symptoms are usually vague symptoms, not particularly related to the gynae problem, like they present with fatigue, tiredness, weight gain, and if they are in the reproductive age group, it is seen that they sometimes present with not able to conceive. So you can say that हाँ कि thyroid disorder जो है they also interfere with the fertility. Right. और मेनोपॉजल एज ग्रुप में अगर हम थोड़ी लेटर एज ग्रुप में देखते हैं जैसे अबव 40, तो उनमें या तो अगर थायराइड डिसऑर्डर है और पिकअप नहीं हुआ है देन इट कैन लीड टू अर्ली मेनोपॉज. सो जस्ट आफ्टर द एज ऑफ 40 if the woman stops having period, then also we need to think about thyroid disorder. And sometimes the perimenopausal age group which we talk, which is 2 years time period just before the period stops or menopause happens, during that time period also the period irregularity tends to be there. So thyroid disorder means they definitely impact the women life right from the adolescent age group till the menopausal age.
So I think it's very important because from young age to the menopause, thyroid hormone is affecting the women. And also, ma'am, both of you will agree with me how important it is to maintain the euthyroid status, especially during pregnancy, to avoid any untoward complication during the pregnancy to the fetus and the newborn baby. तो वहां पर इसकी इम्पोर्टेंस और भी ज्यादा होती। तो इस कहने का मतलब है कि फीटस से लेके फुल एज साइकिल में थायराइड हार्मोन की रिक्वायरमेंट होती है और उसको ऑप्टिमल रखना है। एंड इट्स अ हार्मोन दैट मेक अदर body function to work properly. So permissive action kind of the things happening because of the thyroid hormone. So Dr. Harman, आपसे एक सवाल अक्सर लोगों के मन में आता है कि लेडीज को थायराइड डिस्फंक्शन ज्यादा क्यों होते हैं, एंड ओवरऑल क्या लेडीज में कुछ डिफरेंट कॉज हैं थायराइड हार्मोन के डिस्फंक्शन के, और कॉजेस क्या होते हैं? आर द लेडीज आर मोर एट रिस्क ऑफ हैविंग थायराइड डिस्फंक्शन?
सो हाँ, जैसे कि हमारा जनरली ये दिस प्रोग्राम इज फॉर पेशेंट अवेयरनेस। सो अगर हम कॉजेज की बात करते हैं एज सच कि क्या कॉजेज रहते हैं फॉर थायराइड डिस्फंक्शन, सो यहाँ पे एक बड़ी इम्पॉर्टेंट चीज मैं जो बोलना चाहती हूँ ये है कि इनिशियली शुरू में क्या होता था कि थायराइड हम कॉमनली क्या देखते थे कि पीपल दे यूज्ड टू हैव गोइटर, big gutters, mostly in mountain areas and all.
Right.
So that was happening because of iodine deficiency. Most of the thyroid dysfunctions initially used to be because of iodine deficiency. और वो चीज काफी हद तक सॉर्ट आउट हो गई आफ्टर ऑल द प्रोग्राम्स विच गवर्नमेंट इनिशिएटेड, सॉल्ट आयोडाइजेशन जैसे शुरू हो गई. सो इंडिया दैट वे इज लाइक very kind of progressive country, I would say. So there are not many countries who have started such kind of program, but in India it
And it was 1980s it was started, universal solidization, way back. Yes.
So after that there has been a drastic change कि वो चीजें हम नहीं देख रहे हैं which used to happen with iodine deficiency. So this thing particularly I brought in context because these days people are shifting to the non-iodized salt, so which is actually not good. So पहले क्या था कि वो एक तो थायराइड डिजीज हो ही रहा था, सेकेंडली पर्टिकुलरली इन दिस रिप्रोडक्टिव एज ग्रुप जो फीमेल्स हैं, बिकॉज आयोडीन इज रिक्वायर्ड for thyroid hormone production and even otherwise for normal body function, and this is required for your fetus also. और जो पहले वो चीजें देखते थे हम लोग के मेंटल रिटार्डेशन बच्चों में और पुअर ग्रोथ, that was very common because of iodine deficiency, and now we don't see that. So whatever thyroid diseases we are now seeing in children, that is because of the thyroid gland development issues and all. So it has reduced to a very low level. That kind of mental deficiency is not seen these days. So that is a very important thing that we should maintain, like we should continue with iodized salt. We should not change our salts. So that is an important thing. So otherwise thyroid dysfunction जो आजकल हम देखते हैं in urban areas and people who are using iodized salt, so most commonly it is autoimmune because of antibodies. अब ये जो एंटीबॉडीज हैं, आपको पता है कि हमारी बॉडी के अपने सेल्स के अगेंस्ट ही एंटीबॉडीज बन गई हैं. सो दे आर इन थायराइड डिजीज, इट इज अबाउट द थायराइड ग्लैंड के आपके पास एंटीबॉडीज हैं, एंड दीज एंटीबॉडीज दे वर्क बोथ वेज. कुछ एंटीबॉडीज ऐसी होती हैं जो थायराइड को ब्लॉक कर देती हैं एंड इट डजंट प्रोड्यूस हार्मोन्स, और वो हाइपोथायराइडिज्म हो जाता है. सेकेंड, एंटीबॉडी स्टिमुलेटिंग भी हो सकती है कि थायराइड को स्टिमुलेट कर रही हैं टू प्रोड्यूस मोर हार्मोन एंड यू गेट थायरोटॉक्सिक. So अब autoimmunity has become a more common disease. और जैसे डॉक्टर सुनील ने स्पेसिफिकली पूछा कि आर फीमेल्स मोर प्रोन, सो समहाउ यस, फीमेल्स आर मोर प्रोन. सो थायराइड डिजीज भी समहाउ, ऑटोइम्यून डिजीजेस एज सच भी अगर हम देखें तो दे आर मोर कॉमन इन फीमेल्स. So this particularly thyroid diseases, autoimmunity has also been seen more commonly in females. Although exact reason हम नहीं बता सकते हैं, but it may be related to sex hormones, estrogens and all. But secondly, the problem here is that in females, that hormonal imbalance that we talked about initially, also Dr. Preeti has also mentioned कि फीमेल का बॉडी जो है इट इज लिटिल डिफरेंट. यहाँ पे जो हार्मोनल साइकिल्स हैं, वेरी डेलिकेट बैलेंस इज देयर. सो थोड़ा बहुत इधर उधर होने से सब कुछ डिस्टर्ब हो जाता है. एंड सेकेंडली, लाइक we check more often in pregnancy, in puberty, in period irregularity. So थोड़ा thyroid dysfunction भी sometimes it is important कि उसको regulate करना पड़ेगा. There are situations, not in everybody, but there are situations where we want to make it perfect actually. So yeah, females, so I would say they are more prone for this.
Yeah. Thank you. So I think just for the viewer's sake, ladies are more prone for the thyroid dysfunction, twice as common because of the probably autoimmune nature. एक पॉइंट डॉक्टर हरमन ने बताया कि ये जो सॉल्ट वाला कंफ्यूजन है, सो प्लीज डोंट गेट मिसगाइडेड. लोग धनिये का पानी पिएंगे, they will take all kind of the juices which are probably have no bearing on the thyroid. So to re-emphasize here is that thyroid disorders are the not lifestyle related disorder, except for one thing, that optimal iodine intake, nothing you need to change apart from if you have been advised to have medication, आपको medication लेनी है. Second, other lifestyle thing in the thyroid, just like to emphasize here, people if are having Graves disease, smoking नहीं करनी क्योंकि उसमें thyroid eye disease बढ़ जाती है. Apart from that, you have to have all healthy things which you should do for your maintaining normal health status. Now, next question I will ask Dr. Preeti. Ma'am, how do you screen and diagnose thyroid dysfunction? Because first patient comes to you and you diagnose it where all the life cycle of the lady. So how you diagnose? So for the viewer, so you can guide us.
Yeah, so I would say, Dr. Sunil, this is a very good question. And the clinician, as a clinician, whether you are in obstetrics, gynae, or anywhere,
Yes,
has to be aware about the thyroid disorder and their prevalence in women. So any women, whenever is coming for any type of consultation, so you can say either she's coming for a preventive health check, or she's coming for the preconception counseling, or she's coming for first time in pregnancy, or if the woman is coming later in the life with any problem, then one should always keep in mind to screen the women for thyroid disorder. So what I would say is that in my practice, I made it a point that when we do all the routine investigations, the thyroid screening has become as a routine screening, irrespective whether the woman has any symptom or not. So this gives us a chance to detect all the asymptomatic women, right? Because if somebody is coming for preconception counseling, then that is very important, because the cutoff is different in pregnancy as compared to the non-pregnant women. In pregnancy, we have a very you can say strict cutoff that we want to maintain the thyroid levels or TSH level below that cutoff in order to avoid any complication for the baby and for the mother. If somebody is presenting with any vague symptoms, like as I mentioned earlier, menstrual disorders or tiredness, dizziness, most commonly we see women or the girls coming with weight gain. So there we have to keep in mind to screen them for the thyroid disorder, because if we talk about the most common hormonal disorder in the young age group, which is polycystic ovarian disease. So the diagnosis of polycystic ovarian disease is made after ruling out the thyroid disorder. That is what is the guideline. So I could say as a blanket that every woman who is coming to a doctor with whatever complaint, or even as a preventive health check, also the thyroid disorder is a part of the blood test. So that should be the part of the first initial checkup.
I think a very important message Madam has given. So two things, what I will just do for the audience sake. Number one, low level of threshold is kept. हम threshold level कम तक रखते हैं, और probably everyone we do the thyroid function test if they present for first time. Number two, what ma'am spoke about is the universal screening. Means in West, if you go, there are societies whose guidelines, and they still not convinced to do the universal screening of thyroid dysfunction in women. But in India, because there is no single body which gives the guidelines, and it's an individual base. Also, when patient is coming to the clinician, so then the scenario is different. When you do the screening for mass, then the scenario is different. So in the West, they don't have the universal screening because they have to do for the masses. But here, when the person is coming to the hospital or a patient is coming to the clinician, so screening is not a problem. So universally, we can screen everybody for the thyroid dysfunction, not to miss the condition, because it has an important bearing on many of the aspects of the women at different stages of the life. So Dr. Harman, as Dr. Preeti spoke about, to do the thyroid screening for everyone, like polycystic ovary syndrome in pregnancy and after pregnancy, menopause and all. But many a time we come with the report where the final diagnosis, what we label is the subclinical hypothyroidism. So what is this subclinical hypothyroidism? Can you explain? And so then we will ask more question about this, and we will discuss more about this stage of thyroid dysfunction, which is subclinical hypothyroidism. Yes.
Yes. So subclinical hypothyroidism, actually, yeah. So technically speaking, for like public, it is like your TSH is just at the borderline. I would say normally the cutoffs, they differ lab to lab, but generally it is like 4.5 to 5, which is considered upper cutoff, normal cutoff. So people will come with the report of 6 or 7, something like that. So when Actually, if we see by symptoms, subclinical hypothyroidism is generally not associated with symptoms. If we talk about the general symptoms which people think they are related to thyroid, like mostly it is done on the person has been advised by dietitian, like you are gaining weight, you are not able to reduce weight, basically not gaining, so you should check your thyroid. That is okay, you checked and you found it is 6 or 7, but I would say that was not the reason for your weight gain or not able to reduce weight. Or sometimes you just checked it for some normal weight complaint कि मुझे थोड़ा body ache रह रहा है या मुझे थोड़ा laziness रह रहा है. Some people think that is the reason that ये जो 8 point बढ़ा हुआ है. So that is actually subclinical. Subclinical means generally not associated with symptoms, or thoda sa mild sa raised TSH doesn't disturb you much. But again, it is okay. You should consult physician or endocrinologist to see whether you need any treatment or not. There are certain situations, as we discussed, as Dr. Preeti has also told, like for conception, during pregnancy, sometimes these things may be important, yes, of course, but generally most of the symptoms which you feel, weight and all, that is generally not related to subclinical hypothyroidism, this mild variation. So most of the people, I would say, in our clinic, if we are getting 100 patients, generally 80 patients, they don't require treatment. We just wait and watch. And we just, if we think that it can be a little high risk, we just ask you to come again after 2-3 months and recheck it. But generally that does not require any treatment. Most often it is not required. So in certain situations, definitely, which we cannot like elaborate on this platform, but there are certain situations where you may need treatment.
Thank you. Dr. Preeti, your comment on subclinical hypothyroidism.
I was thinking when I was just hearing Dr. Harman.
Yeah.
So, it's a human tendency. So whenever you start gaining weight, you want to find the reason why you're not able to lose the weight. So most common thing is to do the thyroid function test as a universal screening. And then if we find a level, like our cutoff is 4.5 to 5, and if you find 6 or 7, then you get a relief. Oh, my thyroid is high. This is the reason for weight gain. But actually, the people need to understand that just a mild variation above their normal level is not the reason for any metabolic dysfunction. So that is what is the subclinical, that it is not giving you any effect. But of course, we are finding the TSH level to be high. But then we see that when we do the full thyroid profile, the TSH is high, but then because we know the TSH goes up, then the T3 and T4 level needs to fall. The T3, T4 level will be in the normal range. It's just the TSH which is borderline high. And these are the cases where I think we refer to the endocrinologist, because sometimes we don't know whether they need treatment or not. If they're not falling in the reproductive age group and they're not embarking on the pregnancy, then this is a gray area. We don't know whether somebody needs treatment or not. So then they need a detailed assessment. And that is where we need to refer them to the endocrinologist for the proper advice.
I think this is a very important statement by both my panelists, Dr. Harman and Dr. Preeti, that subclinical hypothyroidism is a quite common entity, जहां पर आपका TSH हल्का सा बढ़ा हुआ मिलेगा and T4 and T3 normal मिलेंगे. A lady, if she is planning for pregnancy or pregnant हैं, तो उनमें तो treatment करना है, हमें delay नहीं करना है, because वहां पर हम absolute normal thyroid function देखना चाहते हैं and we want to follow it up. Apart from that, the group with the TSH level above 4.5 or 5 below 10, many of them can normalize on their own, around 40 to 60% normalize over 5 to 6 years if they have a normal antibody for thyroid peroxidase antigen. So TPO antibody एक अलग टेस्ट हम कराते हैं, anti TPO antibody. अगर वो anti TPO antibody normal है, तो 40 to 60% of the people with subclinical hypothyroidism may normalize over the course of the time. One, if they have had some radiation in the neck, या फिर family history है, या कोई सर्जरी हुई है, तो वो अलग सेपरेट केस होगा. वो हम इंडिविजुअल टू इंडिविजुअल हम बात करते हैं. ब्रॉडली स्पीकिंग, not everyone, as Dr. Harman talked about, 80-20 का ratio रहता है. मतलब majority of the people don't need the thyroid hormone replacement therapy in subclinical hypothyroidism because there are no overwhelming benefit and there is no harm as well of not treating them. Right? So this thing everybody should be aware of. So हम जैसे मैंने बताया कि हम weight के लिए cause ढूंढ रहे थे, हमारे TSS 5.5 मिल गया. So now burden is on that TSS. And many times it's frustrating. अब तो मेरा thyroid normal हो गया, मेरा weight तो और बढ़ गया. So what do I do? And that's the problem because the main thing is not being addressed, our lifestyle, diet, and probably the other reason also. So we should definitely look into that before we start the thyroid hormone treatment. I have 2-3 viewer. Please wait for me for another 5 minutes. I have 2-3 questions, and then of course I'm going to take many of your questions. Question की bombardment दिखाई दे रही है मेरे panel में. So Dr. Harman, क्विकली आप बताइए, आपने उसे बता चुके हैं, प्यूबर्टी एंड मेंस्ट्रुएशन में थायराइड हार्मोन का क्या रोल है? व्हाट इज द रोल इन प्यूबर्टी एंड मेंस्ट्रुएशन? कैन यू एनलाइटन?
यस, अभी जैसे हमने बात कर ही रहे थे, डॉक्टर प्रीति ने भी बताया था कि जनरली जैसे लड़कियां हैं रिप्रोडक्टिव एज ग्रुप में गायनेकोलॉजिस्ट को कंसल्ट करती हैं menstrual irregularity. So जैसे वो delicate balance थोड़ा सा disturb हुआ और period irregularity हो गया, egg development proper नहीं हुआ. Sometimes for like as Dr. Preeti mentioned कि diagnosis PCOS का करने से पहले भी हमें thyroid testing करना होता है कि it may be related to thyroid. So ये एक situation है, yes, during puberty जहाँ पे अभी एक्सेस डेवलपमेंट हो रही है. इनिशियली पीरियड इरेगुलरिटी इज वेरी कॉमन जब आपका पीरियड स्टार्ट होता है, लेकिन आफ्टर सम टाइम, आफ्टर अराउंड 2 years इट शुड रेगुलराइज. बट वहां पे अगर रेगुलरिटी नहीं आ रही है, then definitely we need to check some things and thyroid is one of them. And अगर thyroid dysfunction है और उस टाइम पे yes वो small difference भी matter करता है, we want to make it normal and then see whether your period returns to normal or not. So during puberty initial years, yes, it is important to keep thyroid in check and in balance. That is one condition where we sometimes like to treat subclinical hypothyroidism also. So secondly, again in the reproductive age group, as Dr. Sunil mentioned, that sometimes there is infertility, you are not able to conceive, that egg development is not good. So this is another condition where we like to keep your thyroid profile in normal range and then see if things they become better. So during these phases during reproductive age group, so it is important to keep thyroid totally in normal range. So sometimes yes, you should consult, sometimes it is important to treat. Although most scenarios in subclinical hypothyroidism, we don't treat if there is no abnormality as such, person is doing good, but there are certain situations we would like to treat. So you should definitely consult in these situations.
So thank you. Dr. Preeti, the question to you is that if we are coming across a lady who is planning for pregnancy, या आपके पास में ANC चेक में आया या प्रेगनेंसी हो गई, उनका थायराइड डिस्फंक्शन आ गया, so how do you approach those patients? How do you tell them patient, because उनके अंदर तो apprehension भी बहुत ज्यादा हो जाएगा कि थायराइड डिस्फंक्शन आ गया, प्रेगनेंसी भी हो गई. So how you approach? तो सिर्फ व्यूअर को आप बता दीजिए ताकि उनको भी क्लैरिटी मिल जाए इसके बारे में, beyond our routine OPD timings, which of course we give them.
Yeah, so we do see a lot of patients. So in preconception, if we diagnose a thyroid disorder in preconception time, right? They have been seen in preconception time. So then, yes, of course, we need to explain them that we do have plenty of time and we need to control the thyroid. So it depends on the TSH level. So that how much is the TSH level, and then whether they can straight away embark to start trying for pregnancy, or whether we need to have some time to control it. So I think on an average, our cutoff is, if the TSH is between 8 to 10, then definitely we start them on the med treatment and we say, okay, fine, then you can start trying for pregnancy. But if the TSH is more than 10 and they are seen in the preconception area, then we advise them that we need to wait and use contraception, get the TSH in normal
Normalized.
range,
Yes.
and then you start trying. So
Correct.
this is when they are seen in the preconception area. Then at that time, if the TSH is more than 10, we want to do further investigation as well, that it is not just the hypothyroidism. So as you mentioned, we want to do the test for anti-TPO antibodies, maybe a thyroid scan as well, if we have time.
Okay.
The question is that when they are seen first time in the pregnancy with a higher TSH level, that is the time when sometimes the people also get anxious that the TSH is high and what will be the effect on the baby and on the mother. So there also, like if we follow American college guideline for thyroid disorder in pregnancy, we have a different cutoff in all the 3 trimesters, and we do want to test thyroid levels in all the 3 trimesters if they're normal. If they're not normal, then of course there's a different regime. So in first trimester, we want the TSH level to be less than 2.5, 2.5 or less than 2.5. In second and third trimester, it is 3. Agar thyroid TSH level are more than this level, then definitely they need to be started on the treatment. We know that agar thyroid dysfunction hai, then it can lead to the problem in the pregnancy, which can be in the form of miscarriage to start with in the early pregnancy, then maybe preterm labor, IUGR. And sometimes not directly related, but indirect link has been found between the hypothyroidism and preeclampsia. If we talk about the effect on the baby, then earlier we used to thought that it leads to the developmental deformity in baby, but that is not right. It's not related to the developmental deformity in baby, but of course, fetal hypothyroidism is common if the TSH levels are not controlled in pregnancy. If the thyroid levels are, say, between 8 up to 10, as I said, the same thing, then of course the treatment is started and then they're followed up. But if the thyroid levels are quite high, it is not an indication to terminate the pregnancy. High thyroid level are not indication to terminate the pregnancy, but of course, it's an indication that we need to evaluate the lady appropriately and find the reason and give the treatment. And there is a need to start them on a higher dose of treatment so that the thyroid levels can be normalized quite quickly. As we know that organogenesis happens between 6 to 8 weeks. So ideally speaking, that is the time where we want the thyroid TSH level to be within normal range. And that is why nowadays there is a larger, or you can say important role of preconception counseling. Of course, once they are seen in pregnancy, we want to get their thyroid function in control. But these are the normal problems which we are worried about. That is why we want a strict control in pregnancy.
I think very, very important. So quickly normalize thyroid dysfunction if a lady is first time to detect it with thyroid abnormality or hypothyroidism in pregnancy, and preconception if levels are more, get it treated, normalize, and discuss with this expert, your obstetrician, and they will guide you how to approach for further planning for pregnancy. Dr. Harman, one question to you, and then one final question to Dr. Preeti, and then I'm going to take the viewer question. Dr. Harman, एक anti-TPO antibody के बारे में आपने बताया thyroid autoimmunity का, और अक्सर लोग worried होते हैं, my level is more than 1300 और जो भी upper level of cutoff है. And they keep repeating the antibody, and doc, you are not doing anything for the antibody. How I will normalize? So please इसके बारे में जरा सा viewer को guide करिए.
So that is another important, for public awareness. I have seen people, like, every time when I advise them to come back after like 2 months or 3 months with new TSH reports. So generally we know for hypothyroidism it is TSH which is all important, not even full thyroid profile. But persons, they check TPO antibody as well, and then they will say, oh, it has increased, it has decreased. So I do keep on telling all my patients, when I do the first time, I make sure that I tell them don't do it again. So this is a one-time test just to know the etiology, like why you had hypothyroidism. So that is important for us to know what is the reason, but otherwise it does not have much implications. So it is just telling that you have autoantibodies, that's why you developed hypothyroidism. And if you had antibody once for TPO antibody, I am telling, so it will remain always positive. So there is no need to check it again. Levels, yes, they keep on varying depending upon your, like how active is your immune system at that particular time. Any disease, if it happened like some infection or something where there is excessive antibody production, along with that, TPO antibody will also get a little higher. So it keeps on fluctuating, but it will not harm your thyroid any further. So you already developed hypothyroidism, you are on supplementation, you will have to continue on that, and you just have to follow your TSH. You have to keep your TSH within the range. So TPO antibody will keep
Need
on
not to be repeated.
fluctuating.
Yeah.
So there is no need to check at all later on. So it is
Once
a fun
positive.
time test only. Yes.
Thank you. So once positive means positive, we need not to change because we can't individually, and this is an organ-specific autoimmunity because it's not affecting the other organ. So, Dr. Preeti, one question. So, how we should approach the thyroid dysfunction in the postpartum? Because pregnancy, you have very clearly talked about less than 2.5, 3 in second and third trimester. So, how we approach in postpartum phase? Because that phase is also very important in the lady's life.
Yeah, so correctly said, the postpartum period is quite important, especially for the women who are already on the thyroid medication. So what are normally, and we also know that there is one problem which is called postpartum thyroiditis, which is also a problem which happens mainly in the postpartum period. So the women who is already on the thyroid medication or thyroid treatment, normally what we advise is that to continue the tablet till 6 weeks, which is a postpartum period, because this is the time when there are a lot of hormonal changes happening in the body. So there is sudden withdrawal of estrogen and progesterone. Body is going through the change. Prolactin starts secreting in the body. So this is the time period where the thyroid dysfunction can start again. So we want to continue with the same dose. If the TSH is under control on a particular dose at the time of delivery, we want to continue the same dose till 6 weeks. And then do a repeat thyroid function test. And then from there, we take it forward that if it is in the good control, and then we can switch the women back to their pre-pregnancy thyroid medication if they were already diagnosed. If the thyroid dysfunction was diagnosed first time in the pregnancy, and 6 weeks postpartum, if the TSH is within normal limit, and they're not on a very high dose, then we can stop. If they're on a higher dose, then we can reduce the dose gradually. And then we check again their thyroid function and then aim if it can be stopped. Most commonly asked question is, when the thyroid dysfunction is diagnosed first time in pregnancy, is that whether this dysfunction is going to be continued after delivery, whether I would be required to take this medicine after delivery, for how long after delivery I would have to take, whether I can stop or not. These are the different questions which are commonly asked. So till 6 weeks, we want to give the same dose. After that, we check, and then we can plan accordingly. The other problem which we have to be careful about is the postpartum thyroiditis, which is because of the same autoimmune pathology. And this is the one which can, I guess, can affect any women, those who are not having the thyroid disorder in pregnancy as well. So this is where we need to be careful, and we warn them that about particular symptoms like feeling excessive tiredness, weakness, failed lactation, and sleep disorders. If these are the symptoms, then we need to be checking them for the postpartum thyroiditis and then starting them on the treatment accordingly.
Wonderful. So I think you have answered most of the question of postpartum thyroiditis. This is how the question comes to us. Will I have to take the thyroid hormone entire my life? What will be the dose? And very nicely answered queries of the most of the people. Now I'll take the viewer question and quickly request my panelists to answer the first question of the Sarvanana asked. And Dr. Harman, this is to you. I am taking Thyronorm. I think this should be 25 microgram. In past 3 years, there is any way I can stop it or prevent this? And you have to answer in English only.
Yes. So I think you are the same case where you might have had subclinical hypothyroidism and you were started on mild dose. I can't tell you specifically what you should do right now because I don't know what your thyroid levels are right now. But so as we mentioned, we need to know whether it was a single report or whether you did multiple reports, it was rising or not rising, or whether you had any like autoimmune testing done like TPO antibody. So if you were anti-TPO positive, I would like to continue. So because the chances are that if it was high at that time, it might remain high or it might increase with time. But definitely it depends on the situation. If you just started on just a single report, then maybe, yes, you can consult us. We will tell you whether to stop it or not.
So what is the harm of taking the dose, Dr. Especially when we talk about any lady in the after the menopause, if or at that age, if they are taking thyroxine and will merely slightly increase rate of level of the TSS, what is the harm of taking thyroxine?
Yeah, so as people like the same question people ask us also when we start on thyroxine. When we made our diagnosis that you need thyroxine, then people will Google it, find it like, okay, it is affecting your heart, it is affecting your bones. So that is the thing actually important when you are over treating. So people who are not compliant, that is another problem, like who are not taking medicine properly, who are skipping their doses, and doctors, they keep on increasing their dose. The same thing happens, that you are actually on higher dose than required. So similar is the situation in subclinical hypothyroidism also, when you are treating it unnecessarily. Actually, it was not required, but you're taking it. Yes, it does have some harmful effects. So this hormone, as I told you, it is affecting all of your metabolism. Every organ is getting affected. So heart is an important organ. So you can have arrhythmias and all, it can affect there. So your muscles and bones are also getting affected because of over treatment. So your bones can become weak. So all those things which you see on Google related to thyroxine, they are actually the reason when they happen when you are actually over treating your disease. So that's why we at least check twice when you are having some borderline report. Then we like to check TPO antibody, and then we decide, yes, you need treatment or you don't need. So it is an important point actually when we start therapy. And then it is your responsibility to take your medicine properly so that it is not getting over-treated.
Thank you.
And keep checking every 3-4 months or at least twice a year if you are stable.
Thank you. So wonderful. So, Dr. Preeti, the question from Kiran Jha. I am a thyroid patient taking 162.5 microgram, undergone a uterus removal operation. Will it affect my dose of the thyroxine?
Okay, fine. So the first thing to mention here is that the thyroid dose and the reproductive organ has nothing to do with each other. There is no direct link. Because it is not vice versa. The thyroid disorder can affect the reproductive function, but then the reproductive hormone imbalance will not affect the thyroid functioning. So these two things are not related. I would suggest that you should continue on whatever dose you are, even if you had the uterus removal done. And if you think that your dose is high, then you should get it checked, and then you need to consult the endocrinologist.
Thank you. So one question from Shakshi Puri. Hi, doctor, please advise diet according to thyroid. As I talked in before, there is no specific diet for thyroid. Thyroid is not a lifestyle related disease. Dr. Harman has nicely put forward, after the universal salt iodization, we don't see those people with the large goiter and nodules anymore. We see nodules, but as far as any developed country, and the iodine deficiency spectrum we have stopped seeing because of the universal salt iodization, and that is the only lifestyle thing you need to do. So when you read Google, and today in the newspaper I was reading, there are 5 different kind of the juices which will help you in thyroid. So all these are not scientifically proven, I would say. Don't go for that. Just follow a healthy lifestyle and ensure that you are taking iodized salt. So I think this will suffice. Dr. Harman, quickly, difference between hypo and hyperthyroidism. So underactive and overactive gland, quickly you can tell, then I will take the next question. Yeah.
Yeah, so initially, as I described, so thyroid gland, if it is not working properly, so it is not producing thyroid hormones, which we generally check in your test, which is T3 and T4. So if it is not making thyroxine properly, T4 and T3, which will be actually lesser than required, although it will come in normal range most of the times when you check it. So your brain detects it actually, so that your T3 and T4 is not up to the mark which it should be required for you, because there is a big range for that. So when brain detects it, it produces TSH accordingly. If your TSH goes high, so that means that T3, T4 are not adequate for your body. So if it is not adequate, that means you have hypothyroidism. So T3 and T4 are the thyroid hormones that you need to understand. So generally that is also one confusion, that मेरा तो TSH ज़्यादा है तो आप कह रहे हो thyroid काम नहीं कर रहा है, because TSH is not the thyroid hormone as such. So it is T3 and T4 which might be in normal range, but brain detects it. Yes, it is low for you. So it produces more TSH, and then we come to know, yes, it is underactive, and then we maybe if it is like diagnosed as hypothyroidism, then we supplement it. On the other hand, if T3 and T4 production is high, so in certain situations, you might get hyperthyroidism. So T3 and T4, when they become high, your TSH drops actually. Again, there is a situation where T3, T4 may be at the upper normal range itself, and TSH is too much suppressed. That means your brain is detecting that thyroid is making more hormone than required. So TSH will drop and you are diagnosed with hyperthyroidism. अगर symptom wise देखते हैं, underactive thyroid है, तो mostly आपका जो symptoms होंगे, that will be like low metabolism. जैसे कि you have more of lethargy, more of fatigue. There may be some memory disturbance, heart rate goes low, constipation, all those things, hair fall, and some weight gain. And hyperthyroidism, you are hyperactive actually. There is sleep loss, there is anxiety, heart, you get palpitations, sweating, you feel as if you have fever, although there is no fever. So there is temperature intolerance. So hyperthyroidism, mostly the symptoms are of a high metabolic rate, and hypothyroidism symptoms are of low metabolic rate. So symptom wise also we can differentiate, and biochemistry wise also it is opposite for TSH. So TSH high means you have hypothyroidism, TSH suppressed means you have hyperthyroidism.
Thank you. I think
just add one thing, Dr.
Yes.
Sunil.
Yeah.
It is important in menopausal age group.
Yes.
If the woman is having hypothyroidism, then the symptoms can overlap with the menopausal symptoms, like hot flushes, sleep disturbances.
Right.
And there it is important to do the thyroid function. And if it is hyperthyroidism and you treat that, then the symptoms get better.
So this is one question I have kept, but because of the paucity of the time, I've just skipped that question. So this is very important that at this age, this is little confusing that here this hypothyroidism or subclinical hypothyroidism can be confused with the thyrotoxic stage. So ma'am, you have already answered, but probably Aishwarya seems to join little late. She want to know the common sign and symptom of thyroid in women. So can you quickly just tell?
Common sign and symptom of?
Thyroid in women.
Thyroid in?
Women, ladies. Women.
In women. Okay. So it depends on whether it is a hypo-functioning thyroid or whether it is a hyper-functioning thyroid.
Right.
If it is a hypo, means the thyroid is not functioning properly, then the common symptoms are same as we mentioned earlier: fatigue, tiredness, weight gain sometimes, irregular cycles, mostly delayed cycles, and sometimes it can interfere with ovulation, so difficulty in getting pregnant. Sometimes delayed puberty in adolescent age girls, and that is mainly the concern symptoms. If it is a hyperactive thyroid, then the women suffer from sometimes tremors in hand, hot intolerance, and it can also interfere with the menstrual problems, like mostly they have frequent and heavy periods. And in the perimenopausal age group, it can overlap with the menopausal symptoms like hot flushes, sleep disturbances, and tremors in hand.
Thank you. So I will take quick few questions more. I think this is रेणुका तलूजा, हेलो मैम, 62 ईयर के बाद हुआ थायराइड बाईपास हो गई, उसके बाद थायराइड हो गया, 50 माइक्रोग्राम ले रहे हैं, ये कब ठीक होगा? आई थिंक बोथ ऑफ माय पैनलिस्ट हैव ऑलरेडी आंसर्ड द क्वेश्चन. इफ योर TSS is maintained, there is no harm of continuing thyroxine 50. But in some people with subclinical hypothyroidism, over the time it may normalize, then you need to check it timely. And if the TSS is getting low, you may reduce the dose. Otherwise, if it is maintained at your age between 0.5 to 3 or 4, you need to continue. Another question is the pink Himalayan salt is iodized or not? Dr. Harman, quickly.
Yes,
Pink,
that is kind of the rock salt people are using. So generally they are not iodized salts. So the normal, it is written over the salts like it is an iodized salt. So all other salts, they will not have a proper quantity of iodine. So generally they are non-iodized.
So because iodine remains at the surface of the rock, so because of the repeated rain and the flood, flash, all that iodine gets chelated, and therefore in the rocks there is iodine deficiency in the Himalayas, and that's the reason that the rock salt you will get won't have the adequate amount of the iodine, and the iodine is sprinkled over the salt when it is iodized, right? So this is how the iodization happens, and therefore you won't get the proper iodine in the Himalayan salt and rock salt. I'm PN. I'm diagnosed with thyroid in 2011 after my delivery. Now I'm taking 88.5 microgram thyroxine. Weight loss is there. I'm 42 now. Please suggest some lifestyle changes to get rid of the thyroid hormone. Preeti ma'am.
So already means she's having weight loss, and she is postpartum, right? So
Yes.
it depends on how many months she is postpartum. So adequate sleep is the key thing. Exercise, yes, and proper what we can say is the nutritious diet. Balanced diet is the key thing, and I think during postpartum period is the adequate rest, which is also quite important. And regular testing of the thyroid levels.
Yes. So if in the test your thyroid functions are normal, so your weight loss is not because of the thyroid, we definitely need to see the other reason for weight reduction and appropriately treatment. Vivek, we won't be able to take your question because today's program is only for women. So next time I will take you and you can see me in OPD. So this is Suchita. There are functional medications format advertised these days. Can they cure thyroid from root? Any view on this? I think both panelists will quick comment on this. So the advertisement regarding the cure. Ma'am is saying no, clearly no. Dr. Harman.
Yeah, no.
Yes, so don't venture on that.
I generally tell like people, they will bring some bottles that somebody is giving me this. Sometimes I will not say who. I'm saying if it is working, it has my thyroxine in that, and if it is not working, then it is just nothing.
and the problem is that the previous days desiccated thyroid hormone extract used to be that the dose quantification was not very appropriate. Here the thyroid hormone dose in microgram dose, so the very small minuscule dose is there. So when it is a quantification is not clear, so how can we from the dose to dose variation can be there between the two products? So don't go for those natural. Sometimes people say I'm taking the natural thyroid, not the artificially made thyroid. So that's the problem. We should avoid taking those products. Sonali, I'm your patient taking Theranom 88 because of the half gland removed during my operation. I think Sonali, if your thyroid is maintained, you need to continue. Rupinder, I had total thyroidectomy for Graves in 2013. Dose is 100 mcg. Keep checking every 3 months. Values are okay, but protrusion of the eye didn't go. I am here to treatment. Is any treatment is available? More question is any substitute for synthetic thyroid hormone? People say medicine has a lot of side effects. I think Dr. Harman, that she has two problems. She was operated for Graves' disease. After that, she's still having some thyroid eye disease. Operated in 2013, and she also want to avoid something substitute for synthetic thyroid.
Yeah. So thyroid. So you were operated for Graves' disease and might be having Graves-related ophthalmopathy. So generally, definitely you should remain in follow-up. We need to check like whether it is worsening, it is stable, or it is recovering. So if it is stable or recovering, and there are different parameters actually where we see like whether you need any treatment. So for thyroid eye disease, we do have some treatments available, but they are reserved for specific situations only. If your disease is stable and you are advised to just keep in touch in follow-up, maybe you may not require any treatment. But second thing is that synthetic substitutes, as we already discussed, we don't advise. You should be on a proper dose, because we need to see like how much thyroid hormone is appropriate for you. So as Dr. Sunil mentioned, it is in micrograms. We need to specifically find that level where your thyroid, all the three hormones, they remain in proper normal range. So it has to be very, very specific. So we are not advising any substitutes. And thyroid as such, thyroxine, it is a natural thing only, which you are taking in thyroxine tablets. There is nothing kind of allopathic medicine in that. Yeah. So it is a normal hormone which is substituted because your thyroid is not there in this case, as it has been taken out, or it is not working. So there is no harm in continuing your treatment.
Thank you. So what I tell my patient that it's just like wearing glass. I'm only the panelist who's wearing the glass today, but so it's just like wearing glass. Your eyes are different. You wear the glasses, you are okay. There's no problem. So comment from Nishan is that my favorite doctor is Dr. Harman ma'am. So no question, but come and compliment.
Thank you.
Right. So another question to Dr. Preeti. Ma'am, this is very, very important question. I think you will able to answer. You will answer it. You will definitely guide people. My antibody is positive. So medicine is necessary, and especially in peripartum, ladies planning for pregnancy come with the antibody level. So how you guide them?
So yes, yeah. So if the antibody level are high, as we have already discussed that it should be done once, but then it does happen in real life scenario that it is being done on multiple occasions. And especially in the postpartum time, if the antibody level is being high and the woman is already on the thyroid medication, then it is advisable that the medication should be continued, should not be stopped at their own. The dose depend on the next question is what should be the dose. So the dose needs to be the same as it was during the pregnancy till at least 6 weeks. Do a repeat follow-up with the thyroid levels. And then depending upon the thyroid level, we can decide whether we can reduce the dose or whether you need to continue on the same dose. But please, please, please don't stop thyroid medication at your own, especially in the postpartum period or following delivery, say maybe 3 months or 6 months. Just don't think that I'm fed up of taking the tablet and I would just stop. Just don't stop. See a doctor.
Yes, I think this is a good suggestion. So we do see ladies with coming with the because of the history of the bad obstetric outcome, recurrent fetal loss, ma'am, and then they are found to have increased anti-TPO antibody because you test them, and thyroid function TSH and T4 are normal. So still those people are eligible for treatment as you are recommending because it has an important implication on pregnancy.
Yes, yes. So because anti-TPO antibody means that there is some autoimmune element going on in the body, which is sometimes difficult to pinpoint what it is. So as we already discussed, it's the case-to-case based discussion that we need to do for the anti-TPO antibodies. So if they're positive, although the thyroid levels, TSH and the T3, T4 are normal, but if the history is suggestive, then I think we should consider to start them on the treatment.
Thank you. So it's an individual case-to-case based, not for everyone. If there is history, so then we can plan. Otherwise, not for everyone. Soni Singh has a question to Dr. Harman. 50, she's 50 years. She's on thyroxine 75 microgram. TSS is within normal range. Should I continue or decrease the dose quickly?
You should continue on same dose. So idea of titrating your dose is to keep your TSH in normal range.
Right.
So if we will now increase or decrease it, it will fluctuate. So you should not change. So when it is in range at a specific dose, you are supposed to continue that dose.
So another question from Shakshi Puri. I think we have already taken this question. Should we continue thyroid medicine for lifelong? However, the tests are within normal range. I think both my panelists have answered this question. So this is World Thyroid Day, and our aim is to make people aware about the thyroid dysfunction. And today's theme was the thyroid dysfunction in women. So final comment from both my panelists. What the message you would like to give for the women who are listening to us and who will definitely watch this program later on? Dr. Harman, you first, and Dr. Preeti, then final comment.
So there is one more comment. So the person is saying that he has lost weight and he has he has brought his TSH in normal range. So that is what we are saying. In subclinical cases, you may not require treatment. So as Dr. Sunil mentioned, sometimes it turns back to normal. In many situations, it turns to normal, specifically when you are anti-TPO negative. So that is a perfect situation. Like you did some lifestyle changes and you reduced weight so much, 8 kgs, and you are doing well. So we are very happy for you, and we want that to happen more often. So for females, yes, as we have discussed in this thing, for women, so it is very important for their delicate hormone balance that as we discussed about the universal screening program. So I would say, so in situations like antenatal period, pre-conception counseling, so that is very important. So if we found some thyroid disorder before conception, so that is the ideal time actually. So to decide whether you need therapy or not, rather than being anxious after pregnancy when you get detected with some thyroid disorders. So definitely it is being checked regularly during your first antenatal visit. But at that time, when we diagnose that you have thyroid some disorder, and then we start treatment, there is anxiety both on the physician part as well as on the patient's part. So antenatal checkups are, so pre-conception counselings are very important, and your routine checkup is very important. Secondly, we are advising regular health checks also, and thyroid function is important part of that. And if you are going for regular health checks, so that is an important thing for all the adults where we can diagnose and we can treat. So thyroid disease, you may catch it even without symptoms. So where it is actual hypo or hyperthyroidism and you were not feeling any symptoms, and you can feel symptoms even without thyroid disease, which is a subclinical one where we don't want to treat you. So both the situations may happen. So I would advise regular health checks and pre-conception counseling, which is very important.
Thank you. Dr. Preeti, we have another program, which is in-person program after this for thyroid awareness in the hospital. So but this larger message to the people who've been on viewing us on the web. So what kind of the message you would like to give for women health and the thyroid?
My message would be is that if in case you have been started on a thyroid medication, then please, please, please don't stop it at your own. Right? Don't get distracted by the natural remedies which are there all over there on the internet. Our advice is that you can try whatever natural remedies you want to, but please continue the thyroid medicine. If in case you are in doubt, then you need to see a doctor and don't stop the medicine at your own.
Wonderful. So I think I could not ask for any better discussion session than this. We had a wonderful discussion regarding the thyroid dysfunction in women health, starting from the early age to pregnancy and then postpartum, and where to take, where not to take the thyroid hormone, and how to diagnose and how to treat. Thank you very much, Dr. Harman, Dr. Preeti, for being with us. And I hope the viewer must have enjoyed. And please feel free to comment and reach us for any time whenever you have any thyroid-related issues. Thank you very much for being with us. Thank you. Yeah.
Thanks, Dr. Sunil. Thank you, Dr. Harman.